Hi there, everyone. It's Dr. Melinda here. I know that there are a lot of people afraid right now because of what's going on with the coronavirus. I do want you guys to take it seriously. This is something that is new for us, a new virus people do not have an immunity to. And yes, it is hurting people that are older and immunocompromised. But unfortunately, the younger ones that don't get very sick are actually carriers. So I have a very pissed off teenager right now because I had to say no to her. She wanted to go out with her friends, and I had to explain to her, even though she is not going to get sick, she has the risk of carrying the virus and then getting her 82-year-old grandmother sick. And that's what I'm trying to explain to her. We have to make sure that people understand that even if you're not at risk, you will risk others that are immunocompromised or older. And it's just a hard time for everyone. I told her, I want to go to the movies. I want to go out to eat. I want to have fun too. But it's just a really hard time. So meanwhile, I think this is a great opportunity for us to really think about what is important in life and making sure that we spend that quality time with family. I love having the idea of just staying in. I bought some games that I've been wanting to play, read a good book, watch Netflix, be with the people that you love, and just make sure that you're still practicing good hygiene. So that means you remember the coronavirus can live in the air and also on inanimate objects. So make sure to wash your hands after you touch, a public doorway or anything that someone before you has touched that you don't know, or you just have to be very, very cautious. If you don't have hand sanitizer, you can use regular soap and water. It doesn't have to be the hand sanitizer, but you should wash for at least 20 seconds. So sing happy birthday twice, or 20 seconds of your favorite song. Just do the right thing. Wash your hands. Don't touch your face. The coronavirus has to enter through your nose or your mouth and then make its way to your lungs in order to infect you. So if you don't touch your face, or you're not in a place that can be contaminated, then you're not going to get sick. But remember, just because you're not going to get sick, you might be a carrier for somebody that you love that can get sick. So I know it's hard. It's a big sacrifice for all of us to stay in. But I think it's a serious time for us to really reflect on taking that time with our loved ones. I know some of you know that I lost my father recently. He died on Ash Wednesday, and it's been a really, really tough time for me, especially my mom. And so I see all of this despair through the world and so many people dying, and it's just so heartbreaking. So we need to do our part to really try to contain this virus. And so that means that we have to take the precautions. And please be kind to each other. People are having paranoia and they're so scared and buying up all the toilet paper. Please, people need supplies. Do not hoard toilet paper or other necessary supplies. If you can't find water, remember you can use like the Brita water filters. I just bought some Brita pitchers. You don't need to be terrified that you're not going to have enough water. We have enough water. We have electricity. We have the things that we need to take care of each other. Don't forget to be kind to each other. Just be careful out there. I don't know what else to say. I felt like I needed to say something to my patients and to the community. I am going to be offering like free 10-minute immune consults because I know that people are really afraid and people need help and people want to know how they could support your immune system. Unfortunately, the coronavirus will get people who are immune compromised, who are older. So please, please be careful. And if there's anything I can do to help you, you can give me a call. But if you are coughing or cold or having cold symptoms, please stay home. I don't need to get infected. But all kidding aside, I do want to help people, and I do want to make sure people understand what is important and how you could prevent yourself from getting sick. So don't forget, wash your hands and don't touch your face, and think of other ways to greet people. I like the Ebola elbow, because you can't touch your elbow to your face. And I like the Japanese practice of bowing. That seems to be I did that a lot with my patients this week. But stay safe. If there's anything I can do to help you guys or you have any questions, feel free to call. And I just want to say God bless you all. And I really do care about you. And I hope that I could be of service or answer any questions you may have. And please be kind to each other. Bye.